So, hello everyone. We are here for our podcast Health Matters, and we have a very interesting set of people I'll be talking to today. If you are in Hyderabad, you must have heard about Wellness Hospitals. It was founded in the year 2018. I have the 4 pillars of the hospital with me today, and instead of introducing them, I would love them to start, by sharing their journey with all of you. So, Asad, would you like to start?
I'm Asad Khan. I'm Managing Director of Wellness Hospital. We started in 2018. We started with one branch, around 100 bedded. In 3 years, we expanded 7 branches. Now we have 600 bedded hospital. Right. Still, we have one more hospital is coming up. Surgery.
So I'm Mukesh Mewada. I'm representing this exciting organization, Wellness Hospital. Wellness is all about for the people, and we are giving the best service and providing. We are price conscious people, and people, those who come to hospital, their concern would be a billing, which is like their lifetime earning, and someone who's coming for to our hospital, we see that they should get a value to it. So that was the space where we wanted to explore, and we did, and we started this organization in 2018, and we, with very humble start of 30 beds, today in span of 6 years time, we are doing extremely well, and that's our good fortune that we have experts, and we have this medical professionals with us today. We have 1,500 people today. As a team, we are working very good line of doctors, very good line of nursing, and very good line of people, those who are handling floors, and they are giving amazing result. And this is the first wellness hospital. I take this opportunity. A wellness hospital is the first hospital which is totally digitalized, and we are glad to do this. And we have this IT company which is day in and out supporting us, and getting our thoughts into reality. So we thought that it's an experience you sell, and we wanted to create a space in this vertical where it's a very conscious price market, where urban and rural come together, and we say urban rural or rural urban, where patients come in, and we thought that we should give a professional service. And we've been doing this and enjoying the space, and we see that there is a new service coming up in Nizamabad, which is a standalone building about 50,000 square foot, and the 100-bedded hospital, and that is new addition which will be in a couple of months. And Wellness is aiming to expand more in 3 to 4 locations, which are eventually we are in plans and discussion into some sites where we have to be, and this is this amazing journey. And thank you Times for giving us this. It's an amazing recognition, and we are proud of this. Thank you very much.
Hi, I'm Vivek. I'm co-founder and managing director for Wellness Hospitals. First of all, thanks Times Network for the amazing recognition that we have got. This really motivates us further and raises the bar in the Indian healthcare industry. So we've been working in this space for a long now. So primarily, as Mukesh said, so we're working on a different space. So basically, we work mostly on. So we've been recognized for value-based care, and for us, value is very simple, right? So it's basically better outcomes per rupee spent. So and that's basically the need of the majority of the India now. So that's a real India, which is a majority, which is, as Mukesh said, it's a urban, rural, and rural, urban, which is the major population that we have.
Absolutely.
And we're trying to see what best we can do for each rupee that's spent, and how do we measure these outcomes. So basically what most of the organizations or most of the healthcare institutions face today is there is a big, we talk about digital transformation, we talk about AI, we talk about LLMs, but adoption has become a bigger challenge in India. So that's a primary issue that we are facing today. So what we've tried to do is, from the day one, we had this one question in mind: how do we give this world-class services and at an affordable cost? And for us, we've been looking for answers around this space, and we're trying rigorously going through that. And we're trying to create something called a value-based model. And this value-based model, we measure cost for every patient outcome. And we try to measure this cost from their patient, starting from their journey, from their since they are admitted from the hospital till the recovery. We try to measure their cost in each step, and try to map that outcome with the amount of resources that we utilize. Now, that's why we try to create a balance between the cost and the outcome, and that space is very, very niche in India space. So we're trying to do our best in that space, and as this award also is a testament for that for us. So, and we're trying to change this. This is a niche area that we're trying to work out, and we're looking forward to a lot of new is there.
Yeah, I'm Arvind, handling operations in the capacity of Vice President. So I saw wellness inspirational journey from outside because recently, 4 months ago, I joined wellness. But since many years, I am following founder's journey and wellness journey. It is very much inspirational journey. They started with 50 beds in 2018. From now, across Telangana, they have 6 branches with 600 beds capacity. So we can call wellness as a digital first company and patient-centric company. So wherein lot of innovations are pipeline. I will quote one example since I am handling operations. So in legacy model per se insurance claim, if we have to send, at least it may take 3 to 4 hours. And again, we have to wait 3 to 4 hours for receiving the approval from the insurance company. So that was legacy issue. So here with the use of technology, we readdressed it. So we are training LLM models wherein based upon our past experiences and data, we gave training to LLM models. And those LLM models are really used in operations in each of the process. Insurance is one of such example, wherein we upload, where we give AI prompts. Based upon AI prompt and our previous data and whatever we give inputs to that AI model, so it generates pre-authorization request in fraction of minutes. So that 3 hours process is contained to in a minutes now. So that is one thing. And second, probability of admissibility of the claim. So until unless we receive the confirmation from the insurance company, earlier days we don't know whether it is going to approve or not, whether any capping is there or not. But based upon these LLM models and previous data and experience, now we are able to judge that within 10 to 15 minutes. So that is one of the innovation wherein founders and team innovated in wellness labs, I can say wellness labs, IT labs. So those kind of innovations are going on. So every day there are some new things. So every process has their legacy issues. So we are readdressing with the solutions.
So wellness has taken a lead to empower their staff, empowering staff, and we see that there is a lot of technology coming in, and AI is moving so fast that people can't imagine the kind of evolution is lined up. I mean, where AI will take over, people are insecure about their jobs, but wellness is a place where we empower with this AI with our staff. There is a certain kind of training we are giving. So all these professionals who are thinking about AI, we would rather empower them to use that AI technology and give an optimal result to us. So I think we have done this and we are getting the results, and we are very optimistic that we will we will sail through this challenge also, that fast moving trends of technology, which is every next day you hear something new is coming up, and how do you adapt? And so adaptation and again result oriented is very important, and majorly everything is piling up into the cost. The cost is very that is one subject where people always think of it because it is a costly affair to have this digital or the technology adaptation. that is where I think we have just gone ahead, and we have this counter partner, an IT company, which is supporting us and giving this first-hand information, first-hand technology to adapt in our hospital and get this optimal usage. So we are glad that we are the first movers, and wellness is here to stay, and wellness is winning. Wellness is here. Thank you so much. Thank you.
All four of you talk about wellness hospital with a lot of passion. And is there a backstory to it? Why a hospital that is so sensitive towards a patient's needs? And is there a story behind it?
Yeah, we four of us, we come from a very humble background. I have a person to my left and right, they are rich people, but it was fortunate for majorly we were a humble background, coming from a different walk of life. We four of us had come, there was Almighty's some sign that we had to come on a single platform and execute this part of our role, which are like, we thought of this idea that we will serve people with a purpose. And there was a space where we thought that we can make a mark for ourselves. And we are very fortunate that we had this opportunity to head with a wellness hospital. And that hospital, which we started with not much of expectation, and it was very humble start. And I think
I'd like to add a few points there. So when we initially started in 2018, so it's basically Mr. Suman Gaud, he's one of the founder, who's a basic first founder of wellness hospitals.
Mm-hmm.
So we three are friends, myself, Mr. Suman and Mr. Asad Khan. So we are engineering graduates. So we are into different fields ourselves. Suman was the first one who had this thought about establishing an hospital, and he has gone through his own challenges at family and going through the corporate healthcare, pricing, costing. It all started with that basic question, right? So how do we try to give the world-class care at an affordable cost was the only storyline till now.
Mm-hmm.
We've been trying to align all our strategies in every step only to answer that question since the beginning. And that gave, because we're not diverging our vision from the beginning, and we're taking the tactical steps in every space. So we try to focus only on that space, and then trying to find out all the possible answers that are in that particular space. And that's basically each and every journey as we progress. There have been good hands, good persons who have tied up with us, partnered with us. They're good people, like good partners also who have been joined us in trying to take this journey forward. And to be frank, we've been fortunate to have that space. And then it's a big team. I think we're around 1,500 people now. At a management level, almost 100 now, with doctors, around 200 doctors. It's a great partnership. And this shows how so when we talk about the digital transformations, you need both the worlds, right? You need the clinical world, you need an admin world. So we're playing our role from an administration side, and doctors are playing their role from the clinical side. And that's, I think, is the blend that we are trying to come together, because best of the worlds both coming together and making things happen. And that's the story that we're trying to tell.
So, clearly running a hospital is not an easy job. I'm sure it must be very stressful, but end of the day, what is that one thing that really gives you peace? You all can answer.
So when you see a patient who joins and his hard-earned money, when he comes, he's having so much, he's overwhelmed. The kind of insecurity he goes through and kind of processes today, all the hospitals are having it. When we see that this patient comes with an hope, and when he's getting treatment in wellness and he's getting all right in expected time, and then the moment he gets a discharge and he says, "Thank you, sir." And our doctors, our staff, there is a different culture altogether in wellness. That culture itself makes you so happy that is the reason from 1 to 6 hospitals, and now we are lined up in Nizamabad. Nizamabad is a big thing for us, because it is a Tier 2 city, and someone who is not even thought of. Mr. Suman, Mr. Vivek, And Asad Bhai, they have thought of that Nizamabad would take 50,000 square foot, 100-bedded hospital. So that is all about their vision and the service, what they want to provide for the people. And I'm sure we will be winners. And thank you once again. I'll not miss this opportunity.
Would anyone like to add more to it?
Yeah, so basically I just want to talk a few things around the technology part. Right? So technology has played a big role in this journey. Biggest challenge every institution, as I said before, is adoption of this technology. Because what we've seen there is all the digital transformations that happen. They basically what they don't take the human behavior into consideration. So you build a technology, but it is not adoptable, and then it is of not much use, right? So we've tried to solve this at every step of the entire operations, from beginning of patient admission till the recovery. Everything, like being it outreach programs, be it your as said, the claims processing, trying to educate claims, billing side, be it discharge summaries. So there are a lot of steps where there are pain points. So we try to take each pain point at a time and try to solve how do we solve this as from a technology perspective. Now, thanks to the new trend that's happening in the world with AI, LLMs coming, we're fortunate to be the first adopters of them and try to solve a lot of problems. And it gave a lot of comfort for us to, and the speed at which we are trying to solve, I think, is what is helping us. Like we're trying to bridge that gap. So what LLMs and this AI has done is that previously you needed skill to do certain job, right? So now that skill is getting transformed to a local youth aspect. So we try to train the local youth to adopt to certain models, the training model, and they're able to utilize them and start doing implement there into day-to-day activities. Then that is minimizing our time. Each from clinicians to administrators, there's a lot of time that is saved due to this, and they have their own time to go and do it. Because what we feel is technology should solve for the processes, whereas humans should work on the healing side. So that's a bridge that we're trying to build. So that's where I think technology is playing a bigger role in our journey.
Taking further to what Vivek ji said, any organization, it is all about people management and the leakages. If you can manage people and you know how to handle leakages, I think any organization will always flourish and they'll see the brighter days. So this is a time where technology is supporting you to know where the leakages are. And I think wellness has done that part very well. And we always focus on more of providing the best service, cost effective, because India, majorly people are price conscious. So that is where the wellness had come in, and wellness promotes that, stating that we are for the people and we take care of them. We want to serve them best. Please come to wellness, experience the best of whatever. I don't know what to say about this. I should be more precise on this, that wellness is a place where this is the fastest growing chain because people have trusted us. So I would take this opportunity to thank all our team members, people, staff, support system. Thank you so much. Thank you so very much. And one more time, thank you for this award.
And thank you to all four of you. And here's to greater wellness and bigger successes. So thank you so much. Thank you.